Hello friends, welcome back to my channel Dental Education related to educational videos in dentistry from basics to mastery. So today my topic is on otic ganglion. So we'll see what is otic ganglion and its connections and relations and how it is related to the gland and so on and so things. And these are the content of the video. So the otic ganglion is nothing but it is a parasympathetic ganglion. Parasympathetic ganglion is the ganglion which is related to the parotid gland and it is 2 to 3 mm shape in size. So its location is mainly below the foramen ovale, that is it is situated in the infratemporal region, below the temporal region. So this is the mandibular nerve which passes through the foramen ovale. Branches of mandibular nerve passes through the foramen ovale, below which the otic ganglion is present. And moving on to its relation, otic ganglion is related posteriorly. This is the middle meningeal artery. So it is related posteriorly to the middle meningeal artery, and behind, that is medial side, there is a mandibular nerve. This is the mandibular nerve in which it is situated medial to the otic ganglion, and laterally to its side there is a muscle which is tensor velae palatini muscle. And then moving on to its connections and relations, it has four roots: parasympathetic, sympathetic, and sensory, and also motor root. Moving on to the parasympathetic fibers, this green color is the parasympathetic fibers. So it starts from the inferior salivatory nucleus, that is started from pons, that is lower pons, through which it passes through the glossopharyngeal nerve and its branches with tympanic branch and tympanic plexus. That is, it is a part of glossopharyngeal nerve. And finally, through the lesser petrosal nerve, it reaches the ganglion. This is the otic ganglion, which is present. And postganglionic fibers starts from this otic ganglion and finally through auriculotemporal nerve. This is auriculotemporal nerve. It passes through the parotid gland. This is the main um, flowchart regarding the parasympathetic fibers related to otic ganglion. Then moving on to sympathetic fibers. As a ganglionic thing, it has preganglionic as well as postganglionic fibers. The preganglionic fibers is from thoracic spinal cord, that is the cell bodies in the intermediolateral nucleus of T1 and T2 spinal segment, that is thoracic segment. And from T1 and T2 spinal segment, it reaches above to the superior cervical ganglion, and it forms a relay or synapse, and then from superior cervical ganglion it travels and forms a plexus around middle meningeal artery, and this is the middle meningeal artery. So it forms a plexus around the middle meningeal artery, then after which it passes through the otic ganglion. This blue color thing is an otic ganglion. So this area is an otic ganglion. So after the plexus, it reaches otic ganglion. From otic ganglion, it reaches the parotid gland via auriculotemporal nerve, similar to that of parasympathetic fibers. And then the sensory node is starting from the parotid gland. That is, this is the sensory root. The yellow color is the sensory root, which starts from the parotid gland and passes through the auriculotemporal nerve, that is a branch of mandibular nerve. And finally, the motor root supplies two muscles mainly. One is tensor velae palatini, which is present medially, and tensor tympani muscle, which is situated laterally. So these are the motor branches of otic ganglion. So finally, to conclude, otic ganglion is a simple topic. I think you could understand about the otic ganglion. Thank you. Please do subscribe my video. Thank you.